about it. It's everyone's favorite news reporter, Angelo from Dogface TV. Today is our special interview on Ebola. And today I have Pat Thomas from the nurse medical field to interview. What do you have to say about Ebola?
Well, I think it's a scary disease because it spreads so rapidly.
Ebola make you feel?
Well, as everybody, you kind of feel fearful at first until you really think about it. It was unfortunate that we didn't have all the proper isolation techniques in place when the nurses that took care of Mr. Duncan got ill. But I think everything is really in place now, and it should be contained. Also, I'm really feel good that none of the contacts, with Mr. Duncan, none of those people have gotten ill, and they won't, they've passed their incubation period. So it does show you that it's not as contagious as people fear.
Okay. Name one word, or say one word to describe Ebola. Don't say Ebola.
Infectious.
Nice. Okay. And how do you feel that it has crossed our state borders? Like that one lady in Cleveland, I don't know, I'm not that good at medical thing. I'm a news reporter. Like that lady went on a plane
Yes.
in Cleveland.
Oh, that came from Dallas to Cleveland. Yes, since she'd had direct contact with some of his specimens, she probably should not have been allowed to travel. She did ask, and I think it's just that everything's happened so quickly, the CDC did not react quick enough to get all of their recommendations in place, because I don't think they would let anybody travel now that's had that close contact.
Okay, do you know if anyone that was on the plane that's ever gotten infected? Because I know there's one woman in Akron, I think, with Ebola. That's what I heard.
Oh, geez, I'm sorry, I had not heard that yet.
And how do you feel that has crossed our state borders?
So I guess I'd have to do some research. I didn't realize that there was a case here in Ohio, but I just thought that, we will all have to be vigilant when anybody comes in with a fever. We have to take a good history, including where they've traveled, what exposure they've had, when they've had it, when their symptoms began.
Okay, so Ebola is basically every symptom that is a flu, right?
Yes,
Okay.
and more, but yes.
Okay.
So in that respect, it's very important to get your flu shot, so not so many people will be coming in.
One last question. How do you think we can stop Ebola, like protect ourselves at home?
Well, one of the things is to get your flu shot so that you are not getting fevers and then be worried about having Ebola. The other thing is always good hand washing. And third, I think as a country and as an international community, we need to help the people in Africa, in West Africa, contain this disease and keep it from spreading, because they do not have the resources to do that on their own.
Okay. How do you think we should stop Ebola? Like, should we ban the Africans for coming to America, or ban people to go to Africa in certain places, or like, should we go over and provide medical aid?
That's a good question, Angelo. I personally think that we need to encourage the international community to go and help them contain this disease there. I guess I believe that banning travel would just make some people go underground, and then we'd have no way of screening them when they get here. I mean, they would go to other countries and come here a different way, maybe not directly from South Africa or from West Africa.
So basically you're saying someone could take a flight to like Russia, and then they could get their train to Africa.
Or, take a flight from Russia to the United States or whatever, and not tell anybody that they've been in West Africa.
What do you mean go underground? I just don't think it's possible that you can dig a tunnel under.
No, I didn't mean that. I just mean find other ways and not be honest about how you got here or where you came from by banning travel completely.
Should we send doctors over?
I think we can. Probably the whole world needs to be involved in this, yes, and send some doctors and nurses, and get the resources and be able to set up.
Thank you, Pat Thomas, for being our interviewist today. And stay tuned next time, and thank you for watching. And stay tuned for our next Ebola interviewist. We now take you to Nashville, Tennessee, where a former nurse lives that we're going to interview. Thank you.
Hello, my name is Anne Marie Nordgren, and I'm a nurse practitioner, and I have been invited by Angelo to speak on Dog Face News about the topic of Ebola. What I don't like about it, how I feel about it, what do I think can stop it, and what do I think about the lady who flew from Cleveland to Texas, or actually from Texas to Cleveland and back again. So what I don't like about it, I don't like that Ebola has killed so many already in Africa. And I also don't like that in Africa there is a stigma associated with Ebola, especially with children. If a child's parent dies of Ebola, no one wants to assume care for that child because they are afraid of contracting the disease Ebola themselves. So that makes me really sad. Let's see, how do I feel about it? Well, I think that the original CDC statement may be correct, that people are not likely to contract the disease unless you are in close contact with someone with Ebola, and that people are most likely to spread the disease when they are very, very sick. So I think that has shown to be true, especially when people are being released from quarantine because they show no signs of Ebola, even though they have been in close proximity to someone with Ebola prior to their symptoms. All right, the last thing about the lady from Cleveland. Oh, how do I think we can cure it? All right, there are some medications out there that look like they're being successful, especially ZMapp, in treating the disease. Also, when patients are sick, to make sure that they're well hydrated, and they're also using some plasma transfusions. They've been using this in 3 of the patients in the United States have received plasma from another Ebola survivor. So that is very helpful to know. I hope that eventually the vaccinations will be available, that they could actually help prevent Ebola, and that these vaccines actually were originally started back in preparation after 9/11. So they're in the works, they're out there, they just take a long time to develop. And what do I feel about the lady who traveled on the airplane after caring for somebody with Ebola? I think that the CDC is being very prudent in notifying all the passengers, up to 800 passengers on those flights. They have quarantined the 12 people that she was in contact with in Ohio. And I'm confident now that Emory will provide excellent care to her, and that the CDC is really trying to do what it can to contain the virus. Thank you, Angelo, for having me on today. Good night.
Thank you. We now take you to Iowa City, where we are going to interview 2 people about Ebola. Thank you.
I would like to ask Dr. Sue Odoricio, who is a pediatric oncologist at the University of Iowa and who takes care of many children, what she believes should be the way to handle the people who are afflicted with the Ebola virus, either locally or in the United States. Dr. Odoricio?
Thank you very much. Hi, all the kids from St. Tim's, 5th grade. And hi, Angelo. Thank you for asking Dr. Tom and me to talk to your class. We're very honored to do so. I believe that one of the ways we could help all patients with Ebola who are diagnosed in the United States or come to the United States without knowing they have the infection be cared for properly without our own citizens becoming infected with the virus. My suggestion would be that every state in the United States designate 1 or 2 hospitals in their state that would take care of all Ebola patients. In the state of Iowa, I think that should be the University of Iowa hospitals and clinics, because we are already used to caring for patients who are seriously ill and need to be in an isolation unit. In the state of Ohio, I think you have several hospitals that would be capable of doing that. The Ohio State University Hospital would be capable of caring for these patients. The Cleveland Clinic would be capable of caring for these patients, and I believe the University of Cincinnati would also be capable of caring for these patients. In this way, we could have a team of physicians, nurses, physician's assistants, social workers, spiritual directors, child life specialists, who all would know and be trained specifically how to care for such patients without allowing themselves to be infected. We know now that the Ebola virus is transferred by secretions. Now, secretions can be from your eye, even your tears. If you have a runny nose, the virus can be in that runny material that comes from your nose. You have saliva that keeps your mouth moist, and the virus can be in those secretions. Now, I'm sure all of you at one time or another have been sick and had to vomit. When you throw up, all of the material that comes out of your mouth can have Ebola virus in it if you have the Ebola infection. Anyone who touches that to clean it up and take it out of your room could become infected if they are not properly protected themselves. And also, if you have to go to the bathroom quickly, your urine will have Ebola virus in it if you are a patient with Ebola. And if you have diarrhea, the Ebola virus can be in the diarrhea material. Any one of these places, even a drop, can have enough Ebola virus in it from a person who is infected to make the person caring for him or her sick. That is why we need specially trained nurses, doctors, child life specialists, and social workers. Dr. Thomas Odorisio, I would like to ask you how you think patients for Ebola with Ebola virus should be treated at the University of Iowa Hospital.
Thank you very much for asking me this question, and I'm happy to try and answer it on behalf of Mr. Angelo Odorisio, our grandson at St. Tim's, and this is for all the kids at St. Tim's grade school. I am taught that in the clinic, I need to ask every patient if they have been in West Africa in the last 21 days. And if they have, then we have to take their temperature. And if it is over 100, I am asked them to stay in their room, and I leave the room and I put a mask on the patient and a mask on myself, and I wear gloves and check the temperature again. And if it's over 100, I ask the patient to stay in the room and I close the door. And I will ask all the patients in the waiting room to leave the building. And I am instructed to call the hospital epidemiology department, which is made up of many infectious disease doctors who will then give me instructions or will then come down and help the patient get into an isolation room.
Thank you very much, Dr. Odorisio. and we appreciate your help.
Thank you for asking me.
Today we have learned a little more about Ebola than we averagely know. We have learned how to prevent it, what our medical helpers feel about it, and how to, I don't want to say cure, but how to treat it. Thank you for watching.